Yes, of course, you can run a successful ENT practice without doing any surgical procedures. In fact, ENT as a field allows a lot of activities and procedures that you can do in the OPD itself, where you can sustainably run your clinic without doing any additional surgical procedures. Now, I list down the number of activities you can do. Each of them can be charged anywhere between 300 to 1,500, of course, depending upon a lot of factors, which I will talk towards the end. But one is your OPD consultation. So there's a consultation fee. Then you can do nasal endoscopies. You can buy a pocket portable endoscopy device like we have developed called Hitex, or you can buy the standard endoscope and the kiosk. So nasal endoscopy procedures. You can invest in a microscopy device, and you can do ear microscopy, debridements, micro suturings, ear piercings, wax removals, a lot of those kind of things. You can have a portable audiometry device and do a lot of audiological tests, pure tone audiometries, impedance audiometries. It's a very high volume, test that you can do. And then in addition to that, you can also do things for the voice. You can do laryngeal endoscopy, Botox injections for sulcus vocalis and voice disorders, biopsies, foreign body removals. And if you enter allergy, then you can do allergy profiling and the allergy kits you can use. And those are a little bit more that you can charge. I think 3,000 to 8,000 rupees is what is typically charged for a complete allergy profiling. And then if you do sublingual immunotherapy and all of that, then that's a whole therapeutic domain, which is a source of revenue as well as more definitive care for patients. And then there is vertigo, which is another big area. So if you have electronystagmography or a WEMP device, or you can do neurological assessments, for vertigo and manage patients with vertigo. There's a rotatory chair, and there are all these maneuvers that you can do. Then vertigo is also a big space. And of course, then there is oral, biopsies, tongue tie releases, and a lot of oral procedures that you can do. So all in all, there is a lot to do just in the OPD for patients. There are many therapeutic procedures that can be done safely in the OPD under local anesthesia with certain gadgets that you'll need to invest in. Of course, the success of the clinic is not purely getting a degree and setting up the clinic. If it was that easy, then everyone would be successful. You also have to be good in your skills. ENT is a skill-based field. Even though you don't do surgeries, you require skills even for these small procedures, even for endoscopies, microscopies, assessments, all of them you require skill. So you do need to be good at it. You need to be good in communication. You need to be good in counseling and telling patients the realistic expectations so that they adhere to your treatment. You should be good word of mouth. They should tell that this doctor in this clinic is good. They follow good practices. It has to be in a right locality, right society, and priced appropriately. So all of these factors make it successful.